Very good evening, sir. 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 Hello, very good evening. Hello, very good evening. Am I audible? Hello, very good evening. Am I audible? Hello, very good evening. Am I audible?
Good evening, Daya.
Yeah, yeah, yeah.
Good evening. Hello.
Hello, 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 hello.
ये 3 बार 4 बार क्या बोल?
Very good evening. Very good evening. Very good evening. Very good evening. Very good
Hello. Hello. I'm audible.
Yes, sir. Hello. 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 Very good evening. Hello.
Yeah. Now you are audible.
Thank you, sir. And good evening. I welcome all the delegates from our state, from the different districts for this webinar we are conducting today. This is the special webinar since I want to congratulate every dentist who are participating here on this very World Dentist Day. And I wish the coming session, the coming days, which is we are going to face in 2-3 days, that is International Women's Day. We are going through this phase and we are just empowering the women for dentistry. And the today topic for the scientific session is based on the same. And our esteemed speaker of the evening is also a women dentist who is uh, very good academician and a speaker also. And we will introduce her. And let us start with the today evening sessions. And I wish Dr. Ashok Kumar, CD convener, to say a few words regarding the CD program which we are conducting. Dr. Ashok Kumar, kindly address the meeting. Dr. Ashok, are you there? Dr. Ashok.
Good evening. Yeah, hello.
You are audible. You are audible, Dr. Ashok. You can start.
Yeah. Hello.
You are audible.
Hello, good evening.
Good evening.
Good evening,
You are audible.
respected IDA Honorable President Dr. Vijay Kumar Verma sir, past President Dr. Mohit Kumar, and elect President Dr. Sri Prakash sir, Honorable Secretary Dr. Kumar Manvendra sir, Joint Secretary Dr. Prabhat Kumar Singh, and Moderator Vice President Dr. Dayasankar, Dr. Pulin B. Verma sir, and Dr. Sanjeev Kumar. Treasurer Dr. Anurag Ranjan sir, CDH Convener Dr. Firoz Arman Alam sir, and ex-Secretary Dr. Arunesh Kumar sir and Dr. Amlesh Kumar sir. National ex-Vice President Dr. B.B. Verma sir, Dr. Shovendu Jha sir, and Dr. B.N. Malik sir. I feel great pleasure in putting on records my deep sense of cordial regard and warm welcome to all the honorable members who are attending this webinar. I, Dr. Ashok Kumar Singh, CDE Convener, Bihar State, with my team represent the topic Women Dentist, Changing the Face of Dentistry. Indian Dental Association secure the dignity and honor of its members besides enhancing the image of the dental profession. IDA believes in the importance of oral health for each and every individual and leads the efforts towards attaining the goal. Goal of attending such dental health care can be achieved by updating our knowledge. That's why IDA is regularly organizing CDE for up-to-date education and learning to standard of dental practice as well as better patient care through it. Thank you. Over to you, Dr. Dayasankar, sir.
Thank you, Dr. Ashok, for a warm welcome of our speakers and delegates. And I think our Honorable President of IDA Bihar State is hearing us. Dr. Vijay Verma, sir. Am I audible to you, sir? Kindly unmute your mic and say a few words. Dr. Verma, sir. Dr. Vijay Verma, sir. Respected President, sir. Am I audible to you, sir? I think some connectivity problem is being there with Dr. Verma, sir, who is President, newly elected President for session 2022. On behalf of him, I wish to call Dr. Arvind Khatri. Dr. Arvind Khatri, sir, am I audible to you?
Yeah, good evening, sir. Good evening, Dr. Daya.
Kindly address on behalf of Dr. Verma if he is unable to connect. Dr. Khatri, please.
On his behalf, I welcome all to join the CDE program today, and thank you for the organizers, Dr. Daya and Dr. Ashok Kumar Singh. Welcome all.
Thank you, Dr. Khatri. And before we start the session, let I take the pleasure to introduce the speaker of the evening, Dr. Devika Singh. She has done his graduation and post-graduation from Premier Institute Sardar Patel from Lucknow, and she is having dozen of national as well as international publication to her credit. She is eminent speaker on our IDEA forum also, as well as on national forum also. I wish her that the today topic, since it is related to the upliftment of dental society by women, and she herself is a eminent academician, so I wish she will address this session, academic session, very well and acknowledge us with her skill as well as whatever experience is shared during her post-graduation or during her practice or during her academic career. Dr. Devika ma'am, kindly unmute your mic and address the session, and we start with our scientific session. Dr. Devika ma'am, kindly welcome. We wish you a very good session, and kindly share your knowledge with us. Ma'am, please welcome.
Thank you so much, Dr. Daya, and a very good evening to everyone. I wish a very good evening to all the respected dignitaries who have joined us today, and to all my seniors and my colleagues and juniors and everybody. So before I start with today's presentation, I want to thank IDA and every organizer for allowing me to speak on such a important and relevant topic in today, which is not addressed by many, which is not acknowledged by many. So today I will be shedding light on how female dentists have struggled over the last few years to make their way in the field of dentistry, and their experience and how difficult it has been for the female dentist to attain the position that they have attained in today's society, especially in the field of dentistry. Can somebody please allow me to share my screen? Is my screen visible? Is my screen visible to everybody? Dr. Ashok? Hello, am I audible?
Yes, ma'am. Yes, ma'am. You are audible. You can
Okay, my
continue.
screen is visible.
Yeah.
Okay. Okay, so today we'll be talking about women dentists and changing the face of dentistry. So let's start with the introduction. We know that in the last 50 years, women have struggled a lot. They have come a long way, not just in the field of dentistry, but overall, women have risen in every professional field in this world. And during the struggling period, even when women were stepping ahead, they were really looked down upon by their male subordinate professionals. This was especially in the field which were thought to be male dominant fields, the heavy machinery fields like medicine or any war related fields. The females were always looked upon by the male counterparts. However, in the last 50 years, the scenario has changed a lot, and women have made a place for themselves, not just in the dental field, but in medical and even the research laboratories in India as well now are employing more and more women. And this female employment has begun to challenge the conventional male ideas that have been existing in the society for so long. Now, the literature clearly states that women were bigoted from the dental professional by all means. Women, even if they had hurdles and problems and they had to struggle and they made their way in the professional field, even after that, it was instilled in their mind that a doctor, a female doctor, should only treat women and children. It was believed to be very indignified for them to be treating male patients. So even if female had crossed all the hurdles and managed to attain a position for herself in the society, she was not allowed to treat male patients for a very long time. Now, if we talk about the rise of women in dentistry, it was not just the male gender that did not want female to progress. The women themselves were very reluctant and did not want to join this field because it was believed that medicine, the education, the knowledge of medicine came from Spain and other European countries. At that point of time, it was believed that Spain and European countries have a very bad influence on females. So the women themselves, they did not want to practice medicine during the colonial years. However, in the early 90s, now whatever data, most of the data that we'll be talking today would be about the American data, because if we talk, अगर हम इंडिया की बात करते हैं, तो female डेंटिस्ट्स पे बहुत ही कम डेटा है. हमारे पास डेटा है कि कितने कॉलेजेस बने, कितने डेंटिस्ट आए, कितने डेंटिस्ट गए, बट फीमेल सेंट्रिक डेटा दैट इज particularly concerned with female dentists, India में बहुत ही कम है. So we have taken data from different countries and different continents so that we have an idea how female has risen from a position of no one to a position of a famous dental practitioner in India or anywhere else. So early 1900s, मतलब आज से 100 साल पहले, there were universities in USA which were experimenting and allowing female students to enter the universities. However, when some of the universities were experimenting, majority of the universities, they did not allow female students. They very tactfully and respectfully refused to simply accept any female students. Over a period of years, only a few dozen female graduates started graduating from these dental school. This is not very long ago. बहुत पुरानी बात नहीं है. This is just 100 years. एक century पुरानी बात है. When we had only a few female dentists who were graduating. Now, because the female were a minority and they were facing so many problems, उनका struggle होता था, they did not have company, they did not have motivation, people were pulling them down all along. So they started connecting with each other. They started forming associations. एक ऐसा association which is very famous and which is still active today is the American Association of Women Dentists, which was formed in 1921. And this association is active even today. Now, after this, when World War II happened, the female dentists, they offered the services to the US Army as well. But the Army, they just strictly denied the services of these female dentists. Because again, war एक ऐसा scenario है जहाँ पे they do not allow, even today, the females are not motivated or asked to serve in the wars because it is thought to be a male person's job to be serving in the army or during war times. However, some might say that this war happened to turn to be a blessing in disguise because जैसे अभी यूक्रेन में situation है कि any male person जो 60 के ऊपर है is not allowed to leave the country. They have to stay back, serve the country, and fight in the war. Similarly, during World War II, the citizens were asked to stay back and the male citizens and serve in the war. As a result, बहुत सारी jobs खाली रहने लगी, manpower कम हो गया, and the people to serve the general public, it started falling. लोगों को problem होने लगी. It was during this time that they started taking more and more females, not just into dentistry, but in different various fields. वो और females को recruit करने लग गए. And this World War II turned to be a blessing in disguise for female gender. So some dentists like Sarah G. Kraut, she got around this by joining volunteer emergency services. जब US ने मना कर दिया कि we will not recruit any female dentists, they started offering volunteer emergency services. This wartime economy created job opportunities for women in heavy industry and other roles which were thought to be masculine. Female dentists were able to fill the roles which were left open by men joining the armed forces. In fact, women's presence in the workforce during World War II is considered by many historians to be a key factor in the changes that were to come. Now, if we talk about dentistry in general, so dentistry became more prominent in the 1700s, मतलब 300 साल पहले, बहुत पुरानी बात नहीं है. It was only 300 years ago that dentistry became prominent, not just for females, but for males also. So, and it was believed that females, they always were practicing dentistry. लेकिन वो secretly practice करती थी. They would never come to the clinic and be in the limelight. They would secretly just watch and learn, and they would practice dentistry. So it took until the 1700s for dentistry as we know it today to become more prominent. In all likelihood, women have always been performing dentistry, but it wasn't until the mid 1800s that we saw the first case of women practicing in Sweden United States, and Belgium. Now, like I said, the females were practicing in secrecy. ऐसे ही एक case है Emmeline Roberts Jones. She was the first practicing female dentist in United States. She taught herself basic filling extraction in secret. She joined her husband's practice in 1855, and after his passing, she continued to practice on her own. She was elected to the Connecticut State Dental Society in 1883 and was made an honorary member of the National Dental Association in 1940. Now, like I said, ये सारा data more or less US or Europe का है, because we do not have so much of data in India. But the American Dental Association states that women accounted for only 11% of dental school graduates. In 2018, half of the dental school graduates were women. So in a span of 30 years, 11% से rise हो गया 50%. That's a 39% rise in the females who are graduating in the universities of US. Now today, women are not just getting their degrees in dentistry at higher rate, they are also becoming leaders in dental education and professional associations. In 2010, there were 111 female assistant deans in the dental schools, nearly 7 times more than the 16 assistant deans in 1990. मतलब 20 साल में 16 assistant female dentists से 111 female dentists का rise हुआ है in USA. Kathleen T. O'Loughlin became the first female president of IDA in 2009. Now, if we talk in particular about the rise of women in dentistry, so 18th and 19th century were very difficult and undesirable period for women medical practitioners. It was so difficult that there were even threats of sentencing them to death if they would continue or they would want to practice medicines. On the other hand, there were countries like France who were motivating their women to join dentistry. That is why France plays a very important role in the rise of dentistry, especially in females, because वहाँ पे बहुत सारी female dentists थी who use different tactics to make themselves famous, to make a name for themselves, and that paved way for the future generations, for the future dentists, female dentists, to come forward and attain that education and make a name for themselves. So in the 18th century, a brief dentistry treatise written by Madame Reze was published a few years before in dental surgery, previously used to call Le Chirurgien Dentiste, was published. Through this treatise, she conveyed the message that France was a winsome place for female dental assistant in the late 18th and early 19th century. Reze used to use a balm which used to as a medicament for many dental problems. Now, because it was long ago, we do not have details of what this medicament was, but she became famous because she used to use just a balm to treat many dental problems. Now, in the 19th century, that was footing time in Paris. Madame Anna announced herself as a dentist for women. Why was Madame Anna important and crucial? Was because she was a very famous and eminent dentist in Paris. She used to look after the teeth of members of Royal Duchess of Angoulême. Sooner or later, at the end of the century, Helen Perkins propagandized in the city's newspaper that she can perform painless tooth replacement, cauterize, and cast gold fillings. One of the French women dentists, Mademoiselle Duval, faculty of Paris, after 50 years, gave the first ad saying that she can work on teeth which require prosthetic and gold fillings, can perform extractions without pain, free lesions in periostitis, fistulas, scurvy ulcers, and cancer. So until these females came forward and they made a name for themselves, the livelihood, the income of females who were working in the field of dentistry was very narrow. These females, they came forward, they made a name for themselves. They used different tactics to make themselves famous, and they carved the way for the future female dentist. During 20th century was a very important phase because it revolutionized for the female dentists to come forward and work and make name for themselves. Two major reasons why this century was important was because of the introductions of birth control and professional practice. So what are the factors which caused a shift in gender towards women dentists? First, in 1960 and early 1970s, federal legislation, they funded grants for encouragement of enrollment of women in professional health school. Secondly, there was a far-reaching step of 1976 constitutional amendment, which includes education in the concurrent list. New education policy of 1986 and revised education policy of 1992 makes a pitch for women higher education. And thirdly, standpoint which opened the door for women professional career was the birth control, like I said before. Because of this, the women could choose when to have a child, because once a woman has a child, she is unable to wholeheartedly contribute to her work, and she has other priorities. So the introduction of birth control and the option to use birth control for a female was a very big factor in allowing females to work as per their wish. As these developments were born, which changed and popularized the idea of women as doctor, even though these helpful tool without birth control, all these changes would have been made it possible to make a determination for professional career in dental fraternity. Now, if we talk about the present scenario all over the world for the female dentist, so the advancements of women in academic and research career requires global attention and strategy. Female have risen and पहले से बहुत better situations हैं, but still we are not say we are there yet. Not that females are getting the same opportunity as a male counterpart. So a lot of work needs to be done still to make the women go forward and do and work as hard as male counterparts. Dental student enrollment in the United States is now 42% women. In Finland, 75% of practicing dentists are women. Women dentists in Russia constitute 48% of the dental workforce. 50% of new entrants to dental undergraduate course in the United Kingdom are female. And as per the statistics, United Kingdom they believe that by 2025, more than 55% of all the practicing dentists will be female. The United Kingdom has its first woman dental dean. China and Germany have women dental deans, and 9 out of 56 US dental deans are women. Now, coming to India, India is still growing. It is following the global trend. Abhi bhi rise ho raha hai, but we are still lagging behind. About 15% of the deans in dental schools across the country are female. The same trends are occurring among students also, and about 50 to 60% of students in all dental college in India are female. Now, when we say 50 to 60, ये बहुत बड़ा number लगता है सुनने में, but what we need to understand is कि 50 से 60% are graduating. BDS कर रहे हैं, ये graduation school से कर रहे हैं, but what about these female dentists after that? Not all of them are being provided post-graduation degrees. Not all of them are getting a chance to get additional degrees or getting a chance to work. So, सुनने में बहुत है कि 50 to 60% are graduating. But what after that? That is something that we don't have a lot of data about and something that we need to work on. What are the career choices for females in dentistry? First is private practice. According to Diu et al., majority of female dentists in India are in private practice. Studies indicate that female are more likely to work part-time in private practice than males. Like I said before, This is due to the fact that majority of the responsibility of, say, taking care of a child, looking after the family, taking care of the household, cooking food, most of the time it lies with the woman. As a result of which, uske career compromise ho raha hai, private practice, even if she's doing private practice, she's not able to give her full 100% because she has other responsibilities and priorities to take care of. Now, second career option is academic or government sector. A considerable large percentage of women dentists, they want to work for a salary in government hospital and at universities. It is simply because of the fact that it is a salaried job. Itni salary milni hai, chahe wo government ho, chahe private ho, and the working hours are fixed. So a female can divide her time and know how is she supposed to manage everything when she has to work only for a fixed amount of time. It has also been reported that significant difference between male and female in the work title and specialization were evident in an academic situation. Like I said, this is because of the fact because more men were found to have a higher educational degree, additional degree, and specialization than female. This situation can be explained by the additional responsibility of the female with the family and household. Now, if we talk about the working hours of female dentists do not differ significantly from the working hours of their male counterpart until they have children. The female dentist working hours showed a distinct drop as soon as they start a family. So it is clear that the childbearing and family responsibilities have a great impact on a woman's working life. हम लोग ने बहुत बार colleges में देखा है या hospitals में that बच्चे की छुट्टी है तो it is the mother's responsibility to take care of the child. तो या तो वो बच्चे को स्कूल लेके आए, वो अपने साथ हॉस्पिटल लेके आएंगे या they will take a leave. I'm not saying always, but majority of the time it is the female's responsibility which affects her working hours and her potential to work in a professional field. Females have caring nature, and they understand the patient's problem and they're more helpful towards the patient. So I feel like they would be a better doctors than their male counterparts. Now, if we talk about barriers for female, so far we have talked how women have come a long way, made their way in the field of dentistry, crossed so many hurdles, but we cannot ignore the fact that we have a long way to go. There are still many more barriers and hurdles that we have to cross. More and more women are graduating every year, but after that, they are not able to make the most of their degree. Either they stop studying, they stop practicing, they are not able to get that higher education or additional degrees because they have to take care of their children, their household, and their families. So we have these problems which are still existing in the society for female dentists, and these problems need to be addressed if we want our females to make progress in true sense. So if we are to make real progress towards achieving gender equality, we must support women to challenge these strict gender divisions, barriers they face, conflicts arising from career, parenthood, and family responsibilities are the main problems, are the main hurdles that we see in a woman's career. Initiatives need to engage men and women as allies at home, at work, and in the community, using positive and relevant messages addressing the specific concern of gender equality. Now, just if we talk about, like I said, bahut data nahi hai about Indian female dentists, just a few that I could gather. So very famous is Fatima Jinnah. She was born in 1893. She was younger sister of Muhammad Ali Jinnah, who was the first woman dentist from undivided India. This was before partition. And she passed from the Calcutta Dental College in 1923. She moved to Pakistan afterwards. Second is Tabitha Solomon. She was born in 1900, and she was considered the first Indian woman dentist in true sense, and who was qualified from Calcutta Dental College also in 1928, and then worked at Chittaranjan Seva Sadan and Rufarian Hospital, Kolkata. Solomon worked with Rafuddin Ahmad also in Calcutta Dental Journal. Then is Temi Mino Sorabji Jinwala. She's popularly known as Madam of Periodontology in India. In 1947, she pioneered the first independent department of periodontology in Nair Hospital Dental College, Mumbai. She was awarded a gold medal for the first Dr. Ahmed Memorial Oration by Indian Dental Association. Dr. Jinwala was unanimously elected first president of the Indian Society of Periodontology. Vimla Sood was the first Indian woman to do post-graduation in dentistry. She did her graduation from De Montmorency College of Dentistry, Lahore in 1944. She did her post-graduation in pediatric dentistry from the University of Minnesota, USA, and she worked in Wellington Hospital, Jipma, Puducherry. So in conclusion, I want to share this very famous quote that when you educate a man, you educate an individual, but when you educate a woman, you educate a family. The responsibility of bringing up a family, it is basic in our society at least. A woman is somebody who's educating the child, upbringing the child. So she's making the next generation of our society. So it is very important that we educate our women and help them progress in their respective professional fields if we want our next generations to be better. Thank you. Happy International Women Day is coming, and happy Dentist Day. And let's hope that together we can break this bias. Thank you.
Thank you very much, ma'am. A very nice presentation.
Thank you, sir.
I wish if any of our delegate is having any queries regarding our female delegates, doctor, please, if you have any doubt regarding female dentist, you can ask freely with ma'am.
So any inputs would
Ma'am,
also
I
be
think there
welcome.
is
What they
no any
think
question
about
from
female
audience.
dentists.
I have one question.
Sure, sir.
Ma'am, since you are a good academician as well as doing good practice, what hurdle personally you feel and how you overcome? Kindly share your experience with us, ma'am.
Hurdles, I think there's a very, I have not faced it personally. Firstly, because there is marriage. If you're not married, it does not matter. आप settled हो, आप income है, नहीं है. It is assumed that you have to get married at a particular age, and अगर आप नहीं भी कमा रहे हो, तो your husband would be earning. So how does it matter? तो आप पढ़ाते क्यों हो फिर? I mean, I have not faced this problem, but I've seen a number of female dentists who are facing this, who face this problem. फिर शादी हो गई, and then you know, आप उस life में इतना वो हो जाते हो, involve हो जाते हो that you forget that you have a professional career. And then suppose एक कोई oral surgeon है female, तो लोग देख के बड़े शॉक होते हैं. एक लड़की oral surgery, why is she doing PG in oral surgery? इतने वर्किंग आवर्स डिफिकल्ट होते हैं. हाउ विल शी मैनेज हर हाउस, हाउ विल शी मैनेज हर किड्स? कभी भी बुला लिया जाता है, कहीं भी बुला लिया जाता है. सो आई हैव सीन अ लॉट ऑफ फीमेल्स हु डू फेस प्रॉब्लम पर्सनली. तो प्रॉब्लम तो है ही है कहीं ना कहीं.
Audience, respected delegates, are you having any doubt, anything you wish to ask with ma'am? You are most welcome. Okay, thank you. Just I wish to say thank you on behalf of Indian Dental Association Bihar State Branch, as well as I wish to on behalf of Navixa Foundation as well as Rachel Pharma. I want to thank ma'am who has permitted us and in short notice she acknowledged us with her experience of female dentist, what they are facing and what and share her experience. On behalf of our participant, I just wish to present a certificate on behalf of Navixa Foundation, Russell and Indian Dental Association. Ma'am, this certificate is awarded to you for this very good scientific and knowledgeable scientific session. And this will be mailed to you, ma'am, very shortly after this presentation.
Okay,
Thank you,
thank you
ma'am.
so much.
Thank you
Thank you
very
so much.
much. And I wish to
One
thank our our sponsor, Namixa Foundation, as well as SL Pharma. On behalf of IDA Central, IDA Bihar State Branch, I thank all the delegates who have joined from different part of Bihar. Thank you very much.
sir, one question if
Ha,
I'm
Devika ma'am is
allowed.
there. Ha, please, please.
Sir, like see, we are seeing the problem. Like, okay, the female dentists are facing all these problems. They are not able to give a sufficient time and all. Just it's my query, personal query. Suppose I'm going to have a wife like a dental profession wife, and how I should help her in making my practice also good and her practice also good, including supporting the family also.
मतलब प्रोफेशनल और पर्सनल लाइफ दोनों को कैसे अच्छे से मिक्स करें, यही आप जानना चाह रहे हैं डॉक्टर
या
राकेश?
मतलब हाँ, जैसे अभी मैं अगर प्रोफेशनल एक लड़की से भी शादी करूं, तो हाउ आई शुड हेल्प हर इन डूइंग ऑल दिस थिंग्स.
Good
That is a
question,
very
Dr. Rakesh.
good
Dr. Devika will answer.
question.
Ma'am, please.
जी, see, I feel कि it has to be a collective effort. सिर्फ हस्बैंड वाइफ की प्रॉब्लम नहीं होती है, it has to involve your family also. Suppose आपके you have kids in 2 years, 3 years, तो एक सपोर्टिव, इस बोलते हैं ना, फैमिली इज द पिलर, वही चीज होती है. योर पेरेंट्स, योर इन लॉज, दैट सपोर्टिव एनवायरनमेंट शुड बी देयर. आई हैव सीन इट पर्सनली, जो फीमेल्स काम करती हैं कि उनके इन लॉज बच्चे को रखे हैं, दे टेकिंग, एंड हु बेटर देन योर पेरेंट्स टू टेक केयर ऑफ योर चाइल्ड. बट दैट अंडरस्टैंडिंग हैज टू कम फ्रॉम योर पेरेंट्स. वो आपके पेरेंट्स ही सपोर्ट करेंगे, तभी आपकी वाइफ भी प्रोफेशनली अच्छा कर सकती है, या उसके पेरेंट्स सपोर्टिव हो तो आई थिंक हैविंग सपोर्टिव फैमिली एंड सपोर्टिव पेरेंट्स इज वेरी इंपॉर्टेंट, अगर आप प्रोफेशनली और पर्सनली दोनों में एक्सेल करना चाहते हैं तो. A good support system is very important.
But concept of nuclear family is very much prominent among women. That's the big problem.
To choose कि आप न्यूक्लियर फैमिली को ज्यादा प्रेफरेंस देते हैं, या फिर आप अगर आप न्यूक्लियर फैमिली रखते हैं तो लेट्स से आपकी क्लिनिक है, तो आप क्लिनिक में ऐसा एक क्रैश बनाइए या एक ऐसा रूम बनाइए जहां आपका बच्चा दिन स्कूल से आने के बाद आपके साथ रह सके, आपकी वाइफ को उसको लेके घर पे नहीं रहना पड़े. जिस दिन आपकी वाइफ का अपॉइंटमेंट है, आप उस दिन स्कूल जाइए पेरेंट टीचर मीटिंग में. इट इज नॉट हर रिस्पॉन्सिबिलिटी अलोन की हर बार वही जाए. यू नो, यू हैव टू टेक शिफ्ट्स, इक्वल पार्टनरशिप करनी पड़ेगी अगर आप न्यूक्लियर फैमिली का कॉन्सेप्ट में बिलीव करते हैं तो.
No, it's a nuclear family concept is not basically nowadays the girls are willing for nuclear family. That's why I'm asking, like, if that has to be.
Then maybe she is willing to compromise her career.
Okay.
Then maybe
Okay,
she is willing.
I have this. The best part is like the joint family and supportive family is the reason for female success. Okay, thank you, ma'am. Thank you, sir.
Any
No,
more
sir. No, sir.
queries?
No, sir. Thank you, sir.
We are summing up, and before that, I would like to hand over Dr. Kumar Durgadatta to say vote of thanks to all of us. Dr. Kumar Durgadatta, please.
Thank you, Dr. Daya, sir. A very good evening to one and all gathered here. It gives me immense pleasure to the vote of thanks for this webinar to all dignitaries assembled here. I would like to thank our guest speakers, Dr. Devika Singh ma'am, for today's webinar. She has delivered wonderful presentations for topic women dentist changing face of dentistry. Hope it will helpful for all women dental fraternity. Thank you, ma'am. I would like to thank our session guest for webinar today, respected and beloved President of IDA Bihar, Dr. Vijay Kumar Verma, sir, Honorable Secretary of IDA Bihar State, Dr. Kumar Manves, sir, with your attending this webinar in his very busy schedule. Thank you so much, sir. I would like to thank session organizers for webinar, Chairman of Namaskita Foundations, Dr. R.K. Jha, Joint Secretary of Namaskita Foundations, Dr. Anu, and CD Convener, ID Vihar State, Dr. Ashok Kumar Singh. Thank you for giving all your efforts and supports for these sessions. I would like to thank Dr. Daya Shankar, sir, Vice President of IDVR and moderator for today's sessions. Very nicely done his work today. Thank you so much, sir. Last but not least, I thank all participants for making this webinar success. Once again, I thank you for your participations and your supports. I end with this program few words for a dentist. Today is a dentist day. To all our smile designer dentists, keep on smiles of keep on spreading smiles of a smile. Keep on spreading miles of smiles. Thank you.
We are ending and we are leaving the meeting. Thank you all the participants and thank you Devka Ma'am. We will try soon with another webinar series. Thank you.
Thank you. Thank you everyone. One thing, Dr. Daya sir, you can tell about certificates for same program. Some questions regarding this.
The person who is already registered will get the certificate within few days. On the same mail, they have got their registration done. And if still they want the certificate, kindly mail to the mail given in the link as well as on the browser. You will get the e-certificate on that same mail. Thank you. Thank you very much within day or few.
Thank you, sir. Thank you, everyone.